This is Taylor Smith. I'm with the Umatilla County Plan4Health initiative in Umatilla County, Oregon. And today I'll be talking a little bit about our coalition building and engagement and the process that we use for our community needs and readiness assessment. Briefly, I'll just give a little snapshot of Umatilla County. We're located in Northeast Oregon. We're the green highlighted county in that image. And here's a little snapshot of our health in Umatilla County. Our population is 76,720, so we are considered a rural county. At our last health assessment, we found that 71% of adults were overweight or obese based on their BMI. We found that 21% of adults were not engaging in any kind of physical activity, and that only 4% of adults were eating the 5 or more recommended servings of fruits or vegetables daily. And in that image to the right, you can see some of our cities. Pendleton, Hermiston, and Milton-Freewater are our 3 largest cities, and the rest of those are pretty small cities within our county. Geographically, we are pretty large. And we were in the capacity building stage, an overview of some of our project strategies. We were working on building a coalition and evaluating our community needs and readiness around physical activity and access to healthy food. We worked on education around the intersection of planning and public health, since this was something that was new for both professions in our area. We selected and began implementation on some strategies to increase access to healthy food and physical activity. And we focused a lot on the sustainability of our coalition and ensuring that our efforts would be continued after the Plan4Health grant period. Since we built our coalition from scratch, we were very intentional about the partners that we decided to bring to the table. We wanted to make sure that we had a good representation of health folks and planning folks. We really wanted to get small business and private sector involved. So we have some small business representatives, and we also had some larger business representatives. And we also made sure that we brought small farms, large farms, and other folks to the table. We had some hospitals, school districts, and we also partnered with the Confederated Tribes of the Umatilla Indian Reservation. Their reservation is within our county, so we wanted to make sure that we had them at the table as well. And one of the biggest projects that we worked on was our community needs and readiness assessment. So we have conducted a health assessment, so we had that data to work with, but we really wanted to take things a step farther and dig a little bit deeper into access to healthy food and physical activity. So we chose to use a model out of Colorado State University's College of Natural Sciences, Tri-Ethnic Center. And that model is used in a lot of community interventions to really assess how a community views a particular issue so that you can select strategies that that community is ready for based on their perception of the issue. And so we had that health data, and in conjunction with the data that we collected through this assessment, we really got to paint a much deeper picture of access to healthy food and physical activity, and if our community felt like they could access all of those things when and how they wanted to, or if there were some gaps in there. And we partnered with the University of Oregon's Community Service Center to conduct that assessment, and it was 4 parts to our assessment. So we had a random sample mail home survey, and we ended up getting a little over 300 surveys back. We also conducted 4 focus groups and 6 outreach events and 9 stakeholder interviews with key community partners. And in that picture in the slide, that's at one of our outreach events. It was a crop-up dinner that the OSU Extension was hosting in Hermiston. And so that was a really great way to get in touch with local farmers. And so they were showcasing a lot of local food items that were grown in Umatilla County, and then they prepared those in a lot of different ways. But it was a really great opportunity for us to use our posters and talk to farmers about different things that they're doing. And so we got to dig a little bit deeper into our local food system and talk to people about what we're working on and our food system and how they fit into it and different strategies that they would like to see or participate in the future. And then our focus groups were really aimed at our vulnerable populations in the community. So geographically, I mentioned that we are very large, and so we were very intentional with where we chose to hold those focus groups. So we have southern tip of our county, there are some smaller communities down there that we don't get to a lot. And so we held a focus group down there to talk to folks. And then we also went to a couple free lunch programs to talk to people to get their perspective and opinion on the types of food that they're able to access through those programs, and gaps that they may be experiencing in services. And then our stakeholder interviews were mostly with coalition members, but also just some key community partners that we wanted to talk to and get their opinion and kind of do an inventory around programs that are already happening and services that we already have in the community, and then how Plan4Health could support things that they would like to do in the future. And this is a little close-up of the poster that was in the last slide. So on the left side, we have strategies that were designed to increase access to physical activity. And on the right side, we have strategies that would increase access to healthy food. And we use these at a lot of outreach events, at farmers markets and health fairs and different community events. And it's in English and Spanish, since we do have a large Hispanic population here in Umatilla County. But with these, what we wanted to do is kind of just throw out some ideas that we had for PSE strategies that we thought would be successful in our community, and see how the community felt about them and if they were ready for them, and if they would be utilized if we decided to pursue those strategies. So whether it's improving infrastructure or more parks and trails, we really wanted to know what the community was ready for and what would help them be more physically active and access healthy food. So those were really neat to use, and we just used a dot voting strategy. So we just had participants place 3 dots next to the strategy that they felt was most important. And this is another piece of the community needs and readiness assessment that was produced with, we have a full report, and then this is kind of a summary of it. So U of O broke the assessment results into 6 different groups that they felt were kind of the large overarching themes. Infrastructure was one, safety and comfort was another one, physical access to food and physical activity came up, economic access was another big one, information availability and communication, and then our underlying conditions and systems. And so not only did they lay out the key issues for us and those themes that kind of came up over and over again in the assessment, but they translated that into some opportunity areas for each of those that Plan4Health and our coalition can use in our work moving forward to focus. We were also able to partner with our planning department and their GIS specialists to create maps of the data that we collected. So we'll have some visual representation of all of the data that we've been collecting, so we can kind of see what that looks like on a spatial plane. And the posters that we have with the strategies for access to food and physical activity, we have a lot of those, and we're hoping to continue using those throughout time just to kind of keep that conversation going with the community and to stay in touch with them and really just get their feedback on a continuing basis to kind of see what they feel like is a good strategy for us to pursue and what they would like to see Plan4Health working on. Another piece of our assessment was a half-day workshop that we hosted, and this was with just our coalition members. And we had the initial results of the assessment. So we shared those with the coalition, and we wanted to kind of talk about themes that they saw emerging in that half-day workshop. And so from that workshop, we were able to identify 3 projects that we felt like there was some really good momentum happening already, and we could kind of piggyback on that and make some things happen. So although we were still in the capacity building phase, we wanted to kind of get a leg up on implementation and really have something tangible at the end of our capacity building that our coalition members could be proud of and say that they worked on Plan4Health for a year, and these were the great things that we accomplished. And so the 3 projects that we identified, the first one was around bikeability and transit. And so in early 2017, we'll be working to host a 10 Minutes to Transit Summit. And that will be highlighting our existing transit system, which is free, and the locations where that transit system stops, and then different places that can be reached within a 10-minute walk of that transit stop. So hopefully that'll get people a little more familiar and comfortable with the existing transit system. And then we'd also like to start a dialogue around gaps that we have in our transit system so that we can work to address those in the future. Our second strategy was around educational programming. And as I mentioned, we are a large county. And so in our northern county, Milton Freewater is a city that doesn't have a lot of nutrition education in the schools currently. So we're working with the OSU Extension SNAP Ed coordinator to expand that programming and hopefully bring some more classes and food tastings and things like that to the Milton Freewater School District. And then our third strategy was also around food, but a little bit bigger picture, looking at the food system. We are a large agricultural county. There's a lot of stuff that's grown here, and a lot of it does get donated to the state food bank and distributed throughout the state through a program called Farmers Ending Hunger. And a lot of our coalition members are very active in that, but we would like to kind of take a look at what's happening and figure out what we need to increase our capacity to glean that food and process it and store it locally so that our local food bank and other feeding programs could really utilize that food and feed local community members who are in need. And the biggest lessons that we learned, a lot of this was through conversation with our coalition members and through the stakeholder interviews that we conducted. Meeting fatigue was one that came up pretty regularly. For this capacity building year, we were meeting once a month with our coalition members to talk about different PSE strategies that we could use and doing some education around planning and public health for folks who weren't familiar with both of those professions, kind of talking about the roots of those professions and where they are today. And the meetings were really useful, but it did seem like people feel that they go to meetings every month, and sometimes it can feel like just another meeting. So we didn't want to contribute to that. And so we'll be holding the 10 Minutes to Transit Summit, but we'll also be shifting to a summit format. So we'll be holding 1 or 2 summits a year, and this will be a way for us to meet and touch base with our coalition members, and those 3 projects that we identified from the half-day workshop we'll be touching base on at our first summit in 2017. And hopefully coalition members will have had enough time to really make some progress and some headway on those projects. So we're hoping that those meetings will be just kind of a celebration of the work that's been completed since the last time we met. And we're really looking forward to seeing how that new format works out for us. The other lesson learned, the collective action problem was one that came up a lot. And so that kind of ties into the meeting fatigue. People feel like they go to meetings and they talk about a lot of things, and then you meet again the next month and it doesn't feel like anything has been accomplished. And so we're hoping that, number one, with the county kind of having a full-time position to oversee Plan4Health and make sure that the strategies that we've selected will be carried out and just make sure progress keeps getting made. And we're also hoping that switching to the summit format will give us a chance to kind of feel like we've accomplished a lot in between our meetings. And one of the biggest benefits of our Plan4Health monthly meetings and building this coalition was having new and different faces at the table. So although people felt like it's another meeting, it's something else on my schedule, they were not the same people at every meeting. And so that gave us the opportunity to network and share ideas and to have some cross-pollination between different efforts that we may not have otherwise known about. So that was a huge benefit. And I know that even if people felt like it was one more meeting on their schedule, it was a meeting where we were talking about something completely different and new. And so there was a lot of benefit to having those new faces at the table and being able to tap into projects that we may not have otherwise known about. And so that's all we have for today. As I mentioned, I'm Taylor Smith. I'm the Healthy Communities Coordinator with the Umatilla County Health Department. And if you have questions about our capacity building year, our coalition building and engagement, or the assessment that we used, I would be happy to answer any questions. So feel free to contact me through email or give me a call. And our Director of Land Use Planning was not able to join me today, but she would be happy to answer any questions related to the planning side of things as well. Thank you.